Longstreth, and I'm a PA student at Nova Southeastern. Today I'm going to be performing the cardiovascular, pulmonary, and abdominal exam. Before we get started, I'm going to go wash my hands. So the patient appears to be healthy and no apparent distress. So I'm going to have you take off your shoes and your shirt for this exam. Okay. So I'm going to have you face the window. And first I'm just examining the anterior and posterior thorax for symmetry, contour. I'm looking that AP diameter is 2:1 with L diameter. I'm looking for any skin lesions, superficial veins, and I'm looking at the lips for central cyanosis. I'm looking at the nail beds for cyanosis as well. And everything looks normal. So I'm going to go to the posterior and I'm going to put my hands around T10. Can you breathe in for me? So chest expansion is symmetrical. Next I'm going to have you cross your arms. I'm going to do tactile firmitus, I'm going to palpate the posterior chest wall, and I'm palpating for any deformities, crepitus, step-offs, masses, or tenderness. Is this tender at all?
No.
So there's no tenderness, step-offs, deformities, or crepitus. Okay, next I'm going to do tactile firmitus. So every time you feel my hands, say 99, please.
99, 99, 99, 99.
Tactile firmitus is equal in all fields. Next, I'm going to do diaphragmatic excursion. So there's the diaphragm. Now I'll have you take a deep breath in. Okay, now take a deep breath out. Okay. So diaphragmatic excursion is about 4.5 centimeters. Now I'm going to percuss the 7 lung fields. And I'm percussing for resonance. Normally I would do this under the shirt as well as here. No dullness with percussion. Next, I'm going to evaluate CVA tenderness. Is that tender at all?
No.
No CVA tenderness is noted bilaterally. Okay. Now I'm going to auscultate the 7 lung fields. So every time you feel my stethoscope, just breathe in with an open mouth. So breath sounds are vesicular and symmetric, and there's no adventitious breath sounds. Okay, next I'm going to palpate the axilla and the lymph nodes. So if you'll just put your arm out for me. Okay, so here I'm doing the anterior, the central, posterior, lateral, epitrochlear. And usually I would do that bilaterally, but there's no lymph adenopathies. Okay. Now I'm going to have you lay down, and we'll do the anterior. First, I'm going to palpate the anterior for any crepitus, tenderness, or masses. Is that tender at all? So there's no crepitus, no tenderness, and no masses. Next, I'm going to do tactile firmitus. So every time you feel my hand, say 99.
99, 99, 99.
Tactile firmness is equal in all 3 fields. Next, I'm gonna percuss the 6 fields, 6 lung fields. I'm gonna skip 3, but she's a female. Usually I would do this under. So there is no dullness with percussion. Next, I'm going to listen. So every time you feel this, breathe in with an open mouth. I'm going to skip 3, go to 4. Okay, lung sounds are vesicular and symmetric, no adventitious breath sounds. If there were any adventitious breath sounds, I would do one of these next 3 special tests. For the special test, I'm going to have you sit up. Okay. So first, egophony. When you feel my stethoscope, please say E.
E, 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 E.
Okay, next, bronchophony. When you feel my stethoscope, say 99.
99, 99, 99, 99.
Okay, next, when you feel my stethoscope, whisper 99. So there were normal results for all of those. Next, I'm going to move on to the cardiovascular portion of the exam. I'll have you just face me. So I'm going to first palpate the carotids. Okay, now I'm going to listen with my bell. Can you hold a breath in? Okay, let it out. Hold a breath in again. There's no bruise of the carotids. Next, I'm going to listen to your breath sounds. So, second intercostal space, right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, herbs. Fifth intercostal space, left sternal border, tricuspid. Fifth intercostal space, midclavicular line, mitral. Now I'm going to flip and do it with the bell. So, fifth intercostal space, midclavicular line, mitral. Fifth intercostal space, left sternal border, tricuspid. Third intercostal space, left sternal border, herbs. Second intercostal space, left sternal border, pulmonic. Second intercostal space, right sternal border, aortic. Now I'm going to listen at herbs point. I'm going to have you take a big breath in and hold it. I was listening to the physiological split of S2, and there was a physiological split. Next, I'm going to have you hold an expired breath and lean forward. There's no aortic regurgitation. Next, I'm going to have you Valsalva, third M. So there's no murmurs upon Valsalva. Okay, now I'm going to have you lay down. And I'm going to start by doing jugular venous pulsation. So I'm going to find the sternal angle, which is right here. And I'm gonna put that here. Now I'm gonna look and see point of pulsation. And the JVP is 2.5 centimeters at 30 degrees from the sternal angle. Next, I'm gonna inspect the precordium for any heaves, and I'm gonna inspect the point of maximum impulse. Now I'm going to palpate the precordium at all the 4 valvular areas for any heaves, lifts, or thrills. I don't feel any heaves, lifts, or thrills. And next I'm gonna have you get in the left decubitus position. And I'm gonna find the PMI, which is right here. Okay. So no heaves, lifts, or thrills. And then the PMI is non-distended. Okay. Now I'm gonna listen to heart sounds again. Second intercostal space, right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, herbs. Fifth intercostal space, left sternal border, tricuspid. And then fifth intercostal space, midclavicular line, mitral. Now I'm gonna go back with the bell. Fifth intercostal space, midclavicular line, mitral. Fifth intercostal space, left sternal border, tricuspid. Third intercostal space, left sternal border is herbs. Second intercostal space, left sternal border, pulmonic. Second intercostal space, right sternal border is aortic. Next, I'm going to have you get in the left decubitus position. And I'm going to use listen for gallops. And there are no S3 or S4 gallops. So rate and rhythm are regular, and there are no murmurs, rubs, or gallops. Okay. Next, I'm going to check the pulses. So I'm going to do carotids first, one at a time. Next, I'm going to do brachials. Radial. And I would do femoral, popliteal, posterior tibial. Now I'm going to have you flex your toes and dorsalis pedis. So pulses are equal and full bilaterally. Now I'm going to look at your hand, your nails, for any clubbing or peripheral cyanosis, as well as your toes. And then I'm going to check capillary refill. Capillary refill is under 2 seconds. Now I'm going to palpate the legs. I'm palpating for skin condition, any edema. I'm also inspecting for varicosities. I'm looking for hair distribution and temperature, and everything is normal. So I'm going to move on to the abdominal portion of the exam now. I'm going to have you lay completely flat, put your knees up for me. Okay, so now I'm inspecting the abdomen, and I'm looking for symmetry, contour, symmetrical, normal contour. There's no lesions or there's no abnormal pulsations, and the abdomen is flat and non-distended. Now I'm going to listen. In all 4 quadrants, right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant, epigastric, umbilical, suprapubic. Vowel sounds are present. Now I'm going to listen to the arteries. I'm going to listen to the aorta. This is the renal, the iliac, and then normally I would do the femoral as well as look at the inguinal glands. There's no bruits. The femoral artery would be full and equal bilaterally, and the inguinal glands have no adenopathy. Now I'm going to percuss in each quadrant, percussing for tympani and dullness. So this is epigastric, umbilical, and suprapubic. Now I'm going to percuss the liver. Okay. So the liver is about 6.5 centimeters at the midclavicular line. Now I'm going to percuss the spleen. And breathe in. There's no splenomegaly due to tympani. And now I'm going to palpate. So I'm doing a light palpation first. And I'm looking for tenderness, masses, rigidity, and any guarding. So I just did right upper, left lower, right lower. Now I'm doing epigastric, and then umbilical, suprapubic, and there's no, was that tender at all?
No.
No tenderness. Now I'm gonna do deep palpation. And I'm looking for tenderness, masses, rigidity, or guarding. And I just did right upper, left lower, right lower, and then epigastric, umbilical, and suprapelvic. And was there any tenderness with that? Okay. Next, I'm going to palpate the aorta. Let me find the pulse. Okay, so aorta is 2 centimeters, no lateral extension of pulsation. And now I'm going to palpate here. Let me know if you feel any tenderness.
Mm-mm.
Okay, tenderness at all?
No.
Okay. There's no tenderness with that. Now I'm going to palpate the liver. Breathe in. Liver is non-palpable and non-tender. Now I'm going to have you come this way. Breathe in. Spleen is non-palpable and non-tender. Next, I'm going to do the abdominal reflexes. I don't see any abdominal reflexes, which is a normal finding because everything else has been normal. And then this is the time that I would do the hernia exam, the genital exam, and the rectal exam. Now I'm going to finish up by doing some of the special tests. I'm going to have you put your legs down. So Start out with Murphy's. Breathe in. Okay. So positive, she wouldn't be able to breathe in all the way due to pain. Positive would indicate cholecystitis. Now we'll do iliopsoas. Okay, keep your leg up and push against my hands. Any pain?
No.
Okay. Positive, there would be pain, and that would indicate peritonitis due to API. Now I'll do obturator. Is there any pain?
No.
If there would be pain, it would be positive peritonitis due to API. Now I'll do the heel tap. Any pain?
No.
Pain would mean peritonitis due to API. So now I'm going to percuss. And then I'll have you turn to your side. So a positive test, there would be a shift in dullness and tympany when she was laying versus when she was put on her side, and there was not, but if it were, it'd be positive for ascites. And then last, I'm gonna do rise wings. Is there any tenderness there?
No.
Positive would be pain on the right side, and that would mean appendicitis.